All right, the recording's going. Oh,
Good. I'm Amber Johnson, and I'm going to call to order the Boulder County Board of Health regular meeting. It is April 13th, 2026 at 5:31 p.m. I will have the other board members in attendance. Do roll call.
Morgan McMillan, board member.
This is Steve. Can you hear me?
Yes, so,
Okay, Steve is here.
and a quorum is present. This meeting will be posted on the Board of Health website. The call-in information and the address were included to allow for public participation. We're going to move on to the agenda. Item number 1 is public comment.
so we had Michael Rogers signed up for public comment, but I do not see him online. So we will move on. And we'll keep an eye out if he joins.
Item number 2, approval of prior month's meeting minutes. I will make a motion to approve the meeting minutes from the regular board meeting on March 9th, 2026.
I will second.
All in favor?
Aye.
Aye.
And the motion is approved. Item number 3. That's correct. The on-site water waste treatment system program and regulations.
Thank you. I'll do a quick introduction with you two. Thank you. Tonight, we're going to provide an overview of Boulder County Public Health's on-site wastewater treatment system program. The intention is to make sure everyone is kind of level set on what this program does. In May, we will come back to you. There have been new regulations proposed by the state, and we will come back to you with recommendations on how we interpret those regulations. But we wanted to make sure that everybody got a full orientation before we asked you to make this decision. So Erin is with us tonight, and Rachel, thank you very much. And yeah, turn it over to you.
Yeah. Yes. Rachel, our Environmental Health Division Manager. Thank you, board members, for letting us present on the OWHS program, so the on-site wastewater treatment program. It's really important, I think, in terms of the context that there are a lot of programs and regulations that Boulder County Public Health has shared or joint authority with on the state, but this program in particular is one of the few where the local health department is the regulatory agency. So Erin's going to go through a bit of the background of the first state regs. These are an updated version of those regulations. So she's going to go through just at the end a couple of the big changes that you all will see with the adoption of CDPHE's regulations next month. But also we just wanted to provide a little bit of an overview of what the board's role is in administering this program, what septic systems are and how they work, and why we have pretty complex sites in Boulder County, and the public health significance of these regulations and protecting ground and surface water. And so Erin has a couple of breaks in her presentation for board members to ask questions, and has a lot of pictures to share with you, and also just some background about an assessment that was performed in the early aughts on kind of the status of septic systems in Boulder County, and more of like a public health risk-based assessment that we use for our septic smart program. And I think a very, very exciting and impressive statistic to share with you all. Take it away, Erin.
Yes, well, thank you. Erin Dodge. I am the Water Quality Program Manager in Environmental Health here at Boulder County Public Health. And thank you for your time and attention. And as Rachel mentioned, yeah, I'm going to stop. It's a lot of information, and on some level, you're going to learn why we want you to all be somewhat of a understanding expert, maybe, but not necessarily, obviously, the technical expertise that my team holds to review these technical designs and stuff. But so for the first slide, are you advancing them? Yeah, okay. I was like, wait, was I? too many screens with the same thing. So, septic systems have been in existence for a very long time. They were very primitive, much like everything else. And somewhere in the 1970s, I think 1973, the state adopted the OWTS Act, and that is now part of the CRS Title 25. All of that information is in there, and it lays out some broad requirements for local public health and what they were required to do with regards to septic. And then every county would then be charged with, well, we'll make our own regulations. And so Boulder County Public Health regulations date back to the 1950s. And before that, I would assume it was just kind of rogue. Like, you can actually look at the maps out there, and it was just this big gridded map of Boulder County, and they would just be squares everywhere. And it was ownership by square, and they would get a new map. So when we're talking about these records, that is what we're looking at on a fairly regular basis to try to figure out if records belong to properties or whatnot. So 1950s. And then in 2013, the State Health Department, Colorado Department of Public Health and Environment, adopted Regulation 43. And that was the first time that the state had a comprehensive regulation that didn't just like tell counties how to go about it, but it provided like very specific detail about this type of pipe will be used, these types of tanks, the state have to be approved by the state. So it was a huge jump. And I started overseeing this program in 2014. So that was right before my time. So I didn't get to participate in that process. But Boulder County Public Health and several other, we're not the only one, but we're a fairly progressive county with regards to what our regulations were doing. And so we were definitely a bit of a model, I think, for the state's reg to come around. And as Lexi mentioned, there is a revision underway, and I will talk more about that in a little bit as we get through here. So next slide. So the reason that I was saying you all might have to have a level of expertise in all of this fun information is that you actually have a lot of assigned work duties through the OWTS Act, through the OWTS state regulation, and then subsequently down to our regulation. So you're required to be the ones that adopt our local regulation. Now you delegate that drafting and the development of all that to staff, but having that understanding of it, because then you also would be responsible for holding hearings if we have a variance. So for example, if a property can't meet a setback or there's something else on the property that needs to have a variation from the regulation, it has to come to you all to decide. So there's that. And then there's also, if an appeal is filed, you all would be responsible for holding the hearing. So if we were to deny a septic permit and the community member or property owner said, we really think that this is appealable, then they could have a hearing and come here, and you all would be the ultimate decider on if we move forward with that permit or not. You also review and adopt our fee schedule. And then if you read the OWTS Act, it really talks that the board is responsible for this program. And again, that was in 1973 that a lot of that language was written. And if you look through our records, it really was a very historic thing for the board to approve almost all of our applications. So the board was very busy with environmental health back in the day, reviewing and providing feedback on all of these septic applications. Okay, next slide. So does anybody have any questions about sort of the roles, responsibilities, the regulation? That part was probably pretty straightforward. Okay, so the next section I'm going to do is just kind of give everybody like a primer over what a septic system is. And so this isn't meant to make anybody be like, well, of course I know what a septic system is, but just to level set, make sure we're all working with the same information. So this is a great diagram to just kind of demonstrate. You've got the groundwater well in the background there. So that's the drinking water source coming into the house. And then it gets used in the house and it has to go somewhere. So this coming out of the house, the first thing you see with the two green cylinders on top is the septic tank. And then it comes out through some piping into what it says is the drain field. We use the term soil treatment area Drain field was really back in the day when it was focused, all the regulations were really focused on disposal. Let's just get rid of this wastewater, put it in the ground, never to be thought of again. Now everything is really about treatment because that's what's happening in that soil treatment area. The septic tank also does do a significant amount of treatment. And once it percolates down through the soil, it's, mixing into the groundwater that we see below, which you can kind of see, as the little blue swirly lines there on the left. So next slide. So as I said, the septic tank does do its part to treat wastewater. So the bigger one is just a typical tank. And so the wastewater, it comes in as wastewater and it gets treated and it leaves as what we call effluent. So in that tank, you can see there's like in the wall that's kind of splitting the box, there's a gap. And that is very specific because you want cleaner water to flow through. So you can see there's like some scum, that's like your fats, oils, and greases floating. So that baffle wall, so what we call that, is keeping that scum over there. And then the sludge and all of the solids and stuff that you don't want to go out into your soil treatment area is also falling there. So that the hope is it will settle a little bit more before it makes it out of the outlet pipe, but then you're getting a much more clear effluent. So if you can imagine, if you weren't ever pumping your tank, that eventually that's going to build up and then it spills over and then it can all just go right out the pipes out into your soil treatment area. And these are pipes that just have small holes in them. And so they're going to just eventually clog. I did put this other tank in here because we have a lot of systems with the complexity of Boulder County, what they're called higher level treatment. So this is just an anaerobic environment, but we move into aerobic in these higher level treatment. And this one in particular is showing an introduction of aeration. So it jumpstarts the nitrogen cycle. So you start to have a nitrogen breakdown before the wastewater exits. So this is important because when you're in places like Eldora, where you're literally dealing with like a smaller lot than we would have in like downtown Superior or one of these new subdivisions, then, oh, that's fine. You can jump to the next one. It's, you can't meet setbacks. And so we want to employ better treatment because that also means you're probably not going to meet the setback to your neighbors well, which is, yeah.
Erin, just to clarify, the only time that is required is because of size of lot and not enough room for setbacks, or is there other situations where you would require a higher level of treatment?
Yeah, it helps reduce the setback for certain things. And there is one that I can think of. I'm not going to say there's only one, but there's at least one subdivision that it's written into their HOA agreement. And it's up just north of Longmont, off of Highway 66. I can't think of the name of the subdivision there, but for some reason, all of their properties, and they're not small lots, they're like at least an acre or more. But yeah, for whatever reason, that was their requirement. So that happens in the tank. So as I mentioned, it leaves as effluent and then it goes out to the soil treatment area. So this is where we spend a lot of our time, is looking at that little triangle, and our team goes out in the field and actually so the system is designed by an engineer, and then that is all submitted to us to review for clarification, making sure that it's meeting the regulations. Everything looks good. We do try to use a public health risk approach to that when we're deciding if this is a significant enough deviation to say, we're gonna, send this back and you need to create a revision. One of the areas we spend a lot of time doing that is around soils. So these are just some pictures. So the soils is, we've got clay in Colorado, here in Boulder County, we've got bedrock up in the mountains. You've got different types of bedrock. Its level of competency is what we talk about. Then you can see the upper right-hand picture with the different layers in the soil. So then you're like talking about, well, if we put it this deep, this is the type of soil. So it can get very complicated very quickly. Most important is rocks don't treat. So if you have rocky soil, or even like really nice sandy soil, but a bunch of cobble, like it used to be a riverbed, that is what's going to happen is that water is just going to go in and like go right around the rocks and start to carve that out. And it's just going to go straight down. And what happens when it goes through soil is all the little bacterias and viruses and all the stuff that needs to be treated out of our wastewater is binding to the soil grains and actually getting treatment. So it's very important that because the entire septic system, the soil treatment area is sized on the soil type. So if we don't get that right, you will have an improperly sized septic system that likely will fail or not treat wastewater properly before it re-enters the ground. Okay, next. So when we're thinking about that, as we're talking about how is the water going to move through that soil? So when you have sand on top of soil, it's going to move through that sand pretty quickly. And then if there's a clay layer under that, it's going to stop. So you really need to be thinking about the whole depth of that, it's about 4 feet of treatment for a typical septic system is how much soil you need from where the pipes are down before it hits where it moves past, it's considered treated at 4 feet. And so you have to consider the different strata of the soil. And so that's a picture of somebody doing a percolation test. So we do not do that as much anymore. We focus much more on texturizing the soil and doing like a hand analysis where you go out, you're like, can it form a ball? Can I make myself a nice clay pot? Like, is this all rock and I can't find any soil? Back in the day, Boulder County Public Health staff would go out and do perk tests. They would dig holes and they would sit out there with giant buckets of water and for hours measuring water sitting in holes. So next slide. So I was talking about, you have to have at least 4 feet of treatment. There's a lot of technical things like higher level treatment tanks, for example, that can get you a vertical separation. So you might only need 3 feet of treatment soil underneath. And what we're looking for especially is if it's all good soil, straight 8 feet down, no issues. But sometimes you're going to come across what we call limiting layers. That could be groundwater, that could be bedrock, that could be a very restrictive type of soil. So if it's going down through sand and then hitting a clay liner or a clay, like a lens of clay soil, and you size it for a nice, beautiful sand, you're going to get what we call a bathtub. And that is just going to hit that and it's going to fill up because it's going to be small, not big enough for the clay. And it's just going to become a big bathtub. So this is a picture of a hole that one of the staff members was out and we dug down and it was probably about 3 feet was groundwater. So when we have that happen, then your system actually has to be above grade. So you're creating a mound and you're hauling in sand. So it can be very expensive. We see septic systems in Boulder County easily hitting a $50,000 mark from like engineering to final installation. And groundwater, so you're not always lucky to see groundwater just sitting there because it's very seasonal. We have areas where the groundwater only peaks for about 2 weeks. So if it peaks in that area in June and you're putting in a septic in March, you're not going to know. So you're looking for things like on the very far right with this chunk of soil, that's called modeling. And it's how you can tell that water historically hangs out in that soil. So staff is always looking for those instances to ensure that we are protecting. Lots of research looking at old permits nearby and different seasons and things like that. Okay, next slide. So this is a picture of a property in Eldora, and this is what happens when we don't get it right. So the challenge in Eldora is talking about seasonal groundwater. For right at this time of year, typically, groundwater is at grade. People are walking on boards just to get to the doors of their house because the groundwater is shallow and the snow melt and all that runoff, the whole area is just like a wetland. And this septic system was put in probably a foot or two below grade. And now that system has been removed and it's actually what we call a crib. And the entire 3 feet of soil is above grade and it's got like this, like the timbers built around it, and it's just this like box of wastewater treatment out in their backyard. But okay, next slide. And these are just some pictures of some septic installations in, they're fairly large. Some of them are on some really fun steep slopes. And then the map up above where you can see a few houses, I don't know if anybody can pick them out, but you can actually, this is aerial imagery. We spend a lot of time looking at these from the county's data sets, but you can actually see where the septic systems are. Yeah, so you can see like, I don't know, Patrick, if your cursor even shows up on that, but yeah, you can see the top picture.
The top right.
Top right. Yeah, so.
Sort of.
Yeah, yep. Perfect. Yeah, so there's some in there. And so this is out by Boulder Reservoir. And these lots aren't that big, so you can see how close everybody's septic is, and their well has to fit in there somewhere too. So just another reason why it's important that the public health importance of some of this work. So next slide. Before I continue, I just want to pause there. So that's kind of like the nitty gritty of septics, how they work, and the lay of the land kind of in Boulder County. Any questions? Okay. So, oh, can you go back? Sorry. No, that's okay. So as I said, we've been permitting septic systems since the 1950s. This is a example of a permit from the 1950s. We get to see those. And a lot of times when you're looking at these files, because everything was section township range, it is, this was put in 1952 and this property has maybe never been touched since then. So when we're trying to now say like, oh, we have parcel numbers and we have addresses, and it's not, section 13 in the 69W of this corner of the county, it's very hard to say this permit goes with this property. So the next slide. So this map shows all of the red are parcels in Boulder County that have septic permits. So it's about 14,000 properties throughout the county. And as I said, we've been permitting these from the 1950s. But as you can imagine, because of so many of those, we just don't know, it looks like they're unpermitted. So if you go to the next slide, I'm jumping ahead to my exciting stuff from this slide that Rachel was alluding to. So in 2008, we started to notice like, oh gosh, there's all these parcels that don't have approved septic systems. And so in 2000, or prior to 2008, because the Septic Smart campaign launched in 2008, the staff in the program spent a lot of time looking at the state of OWTS in Boulder County and the different risk factors. So how old are the systems? What is their proximity to waterways? What is the permit status? Do we know if they were permitted or not? And they came up with some strategies of how to ensure that our septic system program was, doing the best it could. And so one of those was looking at the unapproved systems and trying to reduce that number, because at the time it was close to 5,000. So, I guess if you do the percentage, 14,000 out of, 5,000 out of 14,000, not too terrible, but probably not great, especially because a lot of them were near creeks and waterways and in areas like Eldora and Riverside, Raymond, Ward, where they're at the headwaters. So not only is it people's private well drinking water, but City of Boulder and everybody down here. So they identified strategies, and 3 primary strategies that came out of that were to start a title transfer program or a property transfer inspection program. So when a property sells, it's required, the septic system has to have an inspection. Development review, reviewing all of the building permit applications from community planning and permitting to ensure that septic is up to code before they're able to pull those permits. And it also like helps if they're like, we're building an addition and there's going to be 3 more bedrooms. That's the primary way we size a residential septic system is based on bedrooms. And then data cleanup. So the good news is we're moving right along. I think we have to fix a report in Acela, unfortunately, before we can get an exact number. And hopefully that will rise to the top of the Acela to-do list soon. But we are down to probably 600 to 700 unapproved systems. A lot of that was data cleanup. We still have stacks of permits that have an approved septic system that are sitting on a shelf over there, and it's just a file with section, township, range, and it's this tiny thin little piece of like carbon copy paper. That's like their septic permit that says it's approved. So we need to try to figure out what to do with those before we move. So that is good news. And then just some other, oh yeah. Go ahead.
I feel like we talked about this in the last couple of years, Erin, but remind me, other than these property transfers or, or development review, once you get a septic permit, there's no like, you have to renew it every 15 years or it needs to be reinspected after 20 years or anything like that, right? I mean, once you could go for conceivably 50 years without updating or checking your septic.
It is true. There are a few things like, if you have one of those higher level treatment tanks, you're required to have a renewable permit because you are getting a reduction and the risk is higher. So we want to make sure that those are functioning how they're supposed to be functioning and that they're actually getting that. So they are required to maintain that with us. And then there's some things that we're putting into place that like with non-residential properties. So when they change, well, I guess that's still a changing of hands, but we are trying to work towards a better system of figuring out how to keep those, because I think those are another really high risk, potential high risk for public health impact. But yeah, I would love to see all of them on renewable permits, but. Okay, other questions before are we, okay. So I did just want to say that the development review, 35% of those that come through have a communication from us, and 15% of them actually result in some sort of enforcement action. And then our property transfer also, we see about a 20% failure rate on those. And a lot of failure can also include unpermitted septics. Okay, next one. I'm just about done. So there's also just an assumption that if your effluent isn't like surfacing, like that picture of that one in Eldora, oh, it's working. Well, we also know that that is not necessarily true. So these 2 pictures down here is obviously that one's surfacing, but the one on the right probably didn't surface, but you can see that so there's like some curved things in the soil there. And that is actually where the septic system was accepting effluent at one time, and the soil just starts to calcify, and it's a hydraulic failure. So it can just no longer accept water, but sometimes then it creates those like cracks or fissures down through that calcified soil and will just discharge to groundwater. So you don't always see it backing up. And so some things that have a recent study that we just did last year was up above Netherland on Beaver Creek, North Beaver Creek and Coontrack Creek. And they're the red lines on that map there. And we found that there is E. coli in the water. And so then we went back and it was identified that several of the sampling sites had a large indication, had high counts of human speciation. So they do DNA sampling. So there's not a ton of unapproved septic systems that we're aware of. People can always put them in without us knowing, but there's a lot of old septic systems up there. So we're thinking about what is our next sort of step in terms of analyzing the data and doing more there. So other things that have happened or for undocumented systems is finding out that they're just piped directly to creeks. We did a dye test on a property in Longmont, actually, and sure enough, the creek started turning blue, and then we found the pipe that it was just pouring out of. So, and that was at 9th and Hover, if you're familiar with Longmont. So there's some several unincorporated properties there, and that was just in 2013. So who knows how long that had been happening, but yeah. And then just another, this is not local, but I don't know, this Lowndes County in Alabama, it's part of the Black Belt. They have actually seen a reemergence of hookworm, which was once thought to be eradicated in, I believe, the United States. And it's, of course, affecting also a very low income area. And it is linked to failing septic systems. And the sample group that they tested, 34% of them tested positive. So the public health implications, I think, are probably fairly obvious. We should manage our wastewater, but I just think it's interesting information that you just don't really think about. So the next slide. So as we mentioned, the regulation process of the state revised their regulations, and that requires counties to adopt those changes within 1 year of their adoption. So that date will be June 15th. Our regulation is fairly ready to go. It's going to be coming to you in May. We will send information to you before then. The changes, the CDPHE changes are not really things that we can say yes or no to. We have to adopt the things that they put in there, but they were very technical, much more about the design of septic systems and materials you can use and can't use. And then BCPH, we made very few additional changes. We have several new definitions, a few things that will provide clarification, and hopefully a few things that will improve some of our processing, like for license. We license all of the installers and inspectors, so hopefully that will make life a little bit more efficient. So lots more to come on that piece of the topic, but questions, or what do you all think you might need to prepare for the meeting in May, if there's something specific that you're interested in?
I'm gonna set you up as a question. Can you talk about what kinds of questions you would bring to the board, or what are the kinds of regulatory changes that would be proposed in response to the state's changes?
Can you say it one more time? So
what are the kinds of regulatory changes that the board would adopt in response?
So the state's reg is very like verbatim. So for the most part, we'll adopt, like, if that's what you're saying, their changes. I will say there is one change that they made that will require us probably to see you all a lot more. We very often have to have a variance to property line setback, because people are required to stay 10 feet away. And so now the state is going to require more of those. We used to have a workaround, but I think that those days are sunsetting. So,
and that's not something that we can vote on locally.
It would be even more stringent if we were. So they give you like these opt-in, opt-out. So property transfer, for example, it is not a requirement, because there is a lot of counties out in the very rural parts that just do not either have the staff or the political, will support to adopt these programs. So it's considered opt-in or opt-out. So a county can do that, but if you do that, you have to follow these rules. And so they have a few of those other things. And one was something about property line setback. And it was, if you're 3 feet or less, you have to get a variance. Otherwise, it would have been 10 feet or less, and we probably would have needed to have more board of health meetings so that we could get all of those variances passed or reviewed at least. Did I answer your question?
You did.
Okay.
Yeah, thanks. So it sounds like the majority are really just adopting what the state is asking us
Yes.
to adopt.
Yeah, I'll be sure to highlight the ones that are opt-in, opt-out. And they were very few this year. We've been opted into property transfer for a very, since the state reg was enacted, but there's really nothing to.
We have a question online from Steve. Oh, go ahead, Steve.
Were you able to see my hand being raised? I wasn't sure what that was happening or not.
Yep.
Okay. Sorry for, first of all, being a UU. I have no idea what that means. Unknown user. Okay. Apologize. So a couple of questions. First of all, do we have any evidence of any outbreaks or clusters in Boulder County that may be caused by some of these septic system failures? Any historical documentation or something that you have investigated? That's the first question. Second question is, going forward, will the new regs be retroactive in sense that the old systems will not be grandfathered in and let it lay as it is? Or will they have to come up to the new requirements? In addition to the new construction, I imagine will have to meet the new requirements. So those are two questions. Thanks.
Yeah, good questions. So for an outbreak or data in terms of like illness related to septic issues, I do not have any. We see very few waterborne illness, and I don't know if it's an underreporting. And that would, something we work closely with our epi team on those, but something I'm always more curious about, like but I do think that watershed health and seeing issues in the waterways, we do have a large number of streams in Boulder County waterways that are impaired on the state's 303D list, which is the impaired streams list. And then in regards to your second question, so if the system is currently permitted and approved, it is not required to now pull a permit with us and make it up to code. It would only be required if it was put in, like if they were putting in a new system, for example, then they would be required to meet those codes. Now, there is some allowance in in the regulation for repairs, because we're not in the business of saying like, oh, well, you've got to have all these things and it's got to meet all these setbacks. So we need to have some flexibility. Otherwise, we would be evicting people potentially from their house, which we definitely do not want to do. And then we usually create a cutoff date and say, if we receive your application by this date, it will be subject to these regulations. And then if it's from this date after, it's subject to the new regulations, because the engineers will often design a septic system and give that to their client, and they might sit on it for 2 months before they submit that application. So we just like to be able to communicate clearly with people so they know which to design it under, because it will be a significant change. They would have to go back and get a revision in those cases.
So Erin, that's actually the question that was submitted to us via public comment by somebody who was wondering whether or not applications that were in the queue now are considered under the last. I mean, if we end up changing regulations because that's what the state is asking us to do at the next month's meeting.
Yeah.
If your application's already submitted, does that fall within?
Yeah.
Mike Rogers is online.
Oh,
And so
okay.
we can, if
Yeah.
we're done, we can get
Yes.
back to him for it.
Sure, yeah. Yes, if your application is submitted, it is subject to the regulations in effect at the time of your application.
Okay.
Yes.
And Steve, did you have another question, or is your hand still up just from before?
Oh, it's not. I don't know. Okay, now is it down now? Sorry about that.
Yep, that's good. That's okay. Just want to make sure you didn't have a second follow-up question.
Yeah, actually, I do have, sorry. So we will be getting a full write-up of what you're proposing, or what the new regs are going to look like, so that we can review before the next meeting. Is that right?
Yes, so it's probably like 120-page regulation. So my goal is to create a very detailed executive summary outlining the main buckets of the regulation that are changing, and then what some of those changes look like, at least for the state part, because those are really not something we have a choice in. And that was a very well vetted process. The state took, I think, 2 years to do a, community stakeholder engagement and get feedback. So I feel like that process was well vetted, and ours will be more focused, spend much more time talking about the things that are specific to Boulder County Public Health that we have more actual ownership over, and there is not too many. So a bigger lift for our team, I would say, like the staff working in the program versus the changes that the board would need to be catching up on. So if you have something specific that you would love to have, or like a format feel free to send that over and I'm sure I will get the message and happy to try and provide that prior to the meeting with the director's report.
Okay, thank you.
Bit more about like the opt-in, opt-out. I mean, it clearly
Sure.
sounds like best practices to opt in, but is there any penalty for counselors who are opting out?
No, so I'm trying to think of like another thing that I think you can opt in and opt out of is like licensing the people who do the installations. So I think you're correct. Like I think if you were to like do like a national survey, you would see the majority of the states have requirements for property transfer. And I think that 2013 being sort of that first generation of a permit of a regulation that held that specific language, is then I think COVID also sort of slowed some of the progression because health departments were just really overwhelmed and they're like, we can't do that. But it is pretty standard, I think, in a lot of areas.
And the state's goal is to normalize the
Yes.
adoption of many of these opt-in, opt-out.
Yep.
If they're doing active outreach.
Yes, yeah, they are trying to, they're very much so encouraging the counties that aren't participating in those. And we have a group of water quality program managers and we work together to try and create consistency across our programs and have similar forms and like gold standards and lots of tools for counties wanting to adopt programs like that. So, yeah.
I have just one more quick question. I don't know if you shared this already, but what proportion of Boulder County residents currently are under septic system versus a municipal system?
Sure. We have about 14,000, I think it's like 14,052 parcels. I was just looking at the data today. That's why that, that are on septic. And then the rest are on either like a municipal, like City of Boulder sewer, but then we also have a lot of small wastewater districts, like Niwot Sanitation. I can't think of anyway, other small district sanitations like that. Peaceful Valley, that was the one I was trying to
But the
think
majority of the households,
Yeah.
like probably 80+%.
Yeah, so we have what, 300,000 population of Boulder County is like 3 something. Yeah, and so,
I think it's like 110,000
Oh,
households.
right, households, thank you, right, wrong number. Yes, was not comparing the same numbers.
10 to 15%.
Yeah,
Do we expect those rural households that are on septic have fewer people, or do we have any kind of sense of? I'm just trying to get a sense of what percentage of population is, using septic versus municipal.
yeah, I think that's tough. I would have to probably do some diving into some census data, but I would say it's probably similar. I feel like people in the rural areas sometimes maybe have more opportunity for things like ADUs, converting a garage into like a little apartment. Farms also cause a lot of challenges because they want to do everything. They want to have summer camp for small groups of children. They want to make cheese. They want to have demonstration things happening. And, when you're dealing with septic, you just can't start doing new things because you have to think about the impact on that septic system. And in oversaturated soils, if they're wet because there's too much wastewater going out, reduce their ability to treat wastewater is significantly reduced. So overuse, even if it doesn't make it surface or overflow, it's still reducing the treatment that you would get of that wastewater.
But you think it's about half and half of residences with or OWTS parcels and on city?
I think it's like 15% or so.
15% or
Yeah.
Well, 14,000 septic systems divided by 110,000 households is about like 12.5% or something.
Thank you.
Yep. And some of those are also commercial or not residential.
Any other questions? So we're going to make an exception and go back and take a late public comment. This does not mean that will be the new standard going forward of accepting late public comments. But I'm going to go ahead and turn it over to Mike Rogers. Are you still online?
Yeah, I'm online. Hey, no, good job on the presentation, Aaron. My
Thank you.
question was answered. Thank you.
So are you good, Mike? Or Mr.
Yeah,
Wright,
yeah,
sorry.
no, my question was answered. Yep, absolutely.
Okay. All right. Well, thank you. All right. Thank you all. Next.
Item number 4, policy and state legislative updates.
Thank you, Rachel and Aaron. Yeah, go on up. Step on up. So it's April 13th. We're getting near the end of this legislative session. It's always a little bit of a slog, but Tessa has some great updates for us tonight, not just on the legislative session, but also on some local policy efforts.
Yes, thank you, Lexi. My name is Tessa Hale. I'm the policy lead for Boulder County Public Health. I use she, her pronouns. And we will start off talking about the budget. I thought it would be important to just kind of get a lay of the land about the budget because it's complicated, it has been complicated, and it will continue to be so given what's happening. As you may recall, last year, the 25-26 budget, we had a $1 billion shortfall. So there was a special session in the summer to try to figure out what to do about that. And there's several reasons that related to this. Part of it was the federal bill HR 1 changed the amount of tax revenue coming into Colorado because Colorado aligns our tax code with that federal code. So there was that piece. And then just a structural deficit of way more expenses than revenue being collected. So Medicaid, K through 12, education, a lot of services we're providing are just outpacing how much tax is being collected. So there was a lot of sort of shell game shifting money around, one-time transfer of funds that happened. So it made the budget somewhat balanced, but it didn't fix the structural issues. So coming back into this session, there was an additional $1.2 billion gap on top of what we had before. So going into the JBC, the Joint Budget Committee, had a very, very challenging job to figure out what to do about this shortfall. Next slide. So on April 1st, they, after a lot of discussion, put forward their recommendations, what is the long bill or the budget. So 1410, if you wanted to get nerdy and look online to see all the details that are in there, you could do that. The really, really phenomenal news that came out of this is that there had been a proposed cut to local public health agencies' general funds of 3.3 million. And the JBC reduced that to 1.5 million. And I can't understate the significance of this, given how much they had to cut from all programs across the board and what great supporters we had on the JBC who really understand the importance of the work of public health. And I think that CalFO did a really good job. This team did some outreach to talk to legislators and really explain how much we were underfunded before the pandemic, and how much we really need this to be able to support the community. So it seems like a lot, but all things relative, it is a significant reduction in the overall cut. So this implications. So the other notable funding issue is that there was a one-time transfer of $10 million from the Tobacco Education Fund, Prop EE funds, to this universal pre-K funding. We receive funding to do tobacco education and prevention, chronic disease prevention. It's a little unclear what that will mean for LPHA funding. CDPHE had proposed to put $10 million towards these programs that are now going to have to be taken away. So what we have heard is that at CDPHE, they're really working to pull very broadly so that it's not like a significant cut in any one specific program or area, but we don't know yet exactly what that will look like. What it means more broadly is that typically at this point in the game, you know, there are many bills out there that have not been voted on because they have a fiscal note attached, and that each chamber would have some amount of money and sponsors would know that they could pass a bill that had a fiscal note. Word on the street right now is there is no room for any new funding. Everything has been accounted for. I think that there is a lot of wrangling and conversations going on. So who knows what the ultimate outcome would be, but it's unlikely that bills with a fiscal note are going to make it through. We're going to continue to see this in future years. Like, this is a structural deficit that's going to continue to happen. And there's going to continue to be ongoing uncertainty for public health funding. There are two ballot measure efforts that are being put forward that would require signatures, 125,000 signatures from Coloradans to address Tabor. And one would be to reduce that limit on how much Tabor tax revenue could be held back by the state for other uses. And then the other is to do that plus have a graduated income tax. So those are just things that we'll watch, but without that, this is going to be a problem, same problem we'll see next year. So next slide. So this is an update on legislation that we have supported. We're happy to report that the ensuring immunization access for Coloradans was signed by the governor. Legal protection for the dignity of minors was sent to the governor. This is the one that protects minors' name changes and keeps those sealed and confidential unless the minor decides for some reason that they want to reveal that information. The next three are still kind of in the works. Treating people with behavioral health disorder. This is really about secure transportation for people experiencing mental health crisis. Mobile home park water quality. This is sort of adding on to that state legislation already protecting water quality in mobile home parks, but to say that remediation of welfare-related water would need to be taken care of and park owners couldn't pass that cost on to residents. And then the last one is measures to improve Black maternal health equity, which is really to address the disparity in outcomes of Black mothers. And this has a fiscal note attached that was being addressed. So these are ones that we are hoping will continue to make it through. Anything in appropriations, we're just going to keep an eye on. Next one. Similarly, provider participation in health insurance. This is the bill that would be preventing from, if you're going to look for an insurance provider through your network and you call and they're not taking new clients or patients, or they're not in service anymore, it would help sort of clear out all of those quote unquote ghost providers, making it easier to find healthcare. That one has passed the House and Senate, so we anticipate that'll go forward. The next one, protect safety of individuals who are immigrants. This is really a holistic bill taking a look at how do we ensure that law enforcement agencies are reporting on their activities, preventing different agencies from collaborating on deporting immigrants. And then related mostly to public health is establishing health and welfare regulations in facilities. So a part of this really came from a facility, an ICE detention facility in Aurora that had people who were really getting sick in close quarters, not being able to quarantine, not having access to basic sanitary needs. This does have a fiscal note, so we're keeping an eye on it. Two bills we were supportive of did not make it through. One was the Alcohol Impacts and Recovery Enterprises. This was going to generate funding to support alcohol and substance use intervention and treatment programming, and it did not make it through this year. It will probably come back next year. And then hospital funding was an excise tax on alcohol, and this was to build a facility in Aurora with 50 to 70 beds for treating people with serious mental illness. So those both did not make it. And legislation that we do not support, expanding the Colorado Cottage Foods Act, that is still alive and kicking, and it has a fiscal note. This is the one that expands the types of foods that can be provided. We've had a lot of engagement on this. We've provided testimony. We've provided some facts and figures. And it does have a fiscal note of one full-time employee to be at the state. It does also, late breaking on Friday, the bill sponsor put in an amendment that would provide $1.5 million of funding to local public health agencies, but there is no money for that to happen. And
It would be shifting it from one pot that benefits public health to another pot that benefits public health.
so we're keeping our eye on that bill. Alcohol beverage manufacturer sales. This was one where for alcohol producers, small craft producers would be able to sell alcohol that other small craft producers made in their tap rooms, but it would require that they had a level of food and snacks, which would require public health food safety inspections. That was postponed indefinitely. The other was alcoholic beverage entertainment district. So this was making it easier to create an entertainment district where you could have alcohol or you could have your bar open until 4 or 5 in the morning. That was also postponed indefinitely. The THC beverage bill has not been introduced. There is still talk, there is still anticipation it will be introduced. This would allow for THC beverages that have 10 milligrams of THC to be sold anywhere that alcohol is sold. So at grocery stores, at sports games, at liquor stores. This is a public health challenge we see in many ways, especially for youth access, or if the onus is on a bartender at a baseball game to determine if someone is under the influence too much to be able to have this. It's really hard to make sure that people would not overindulge. And
As it is with alcohol.
true.
Can I just make
yeah.
a comment on the second to last one, the alcohol beverages entertainment district? This is something we occasionally talk about in our Metro Denver Partnership for Health meetings. And there are a lot of counties that kind of don't care about it. And then there are some counties that feel very strongly about it. And it's something that we're going to be watching because I'm curious if bringing Sundance to Boulder will influence our position on this bill in the future.
Yeah, that is absolutely one that with Sundance coming here, that would have a big impact for a period of time.
When Sundance is
January
20, less than a year.
21st to 31st.
Okay, moving on to state regulation. So one of the things that we're working on is addressing the cleanup of methamphetamine affected properties, or MAPs, which the core issues with this is that it's very expensive. The regulation was written at a time when there were meth labs in Colorado. Now it's impacting people where meth was smoked maybe one time, but it's in someone's home. It is immediate cause for eviction. The remediation is incredibly expensive, so much so that housing stock is not available.
The way that it's typically done is expensive.
Yeah, it's done above and beyond where it needs to be. The level of toxicology is higher than there's any evidence base for, and other countries, and the state of California have a lower threshold or a higher threshold for requiring that level of remediation. There's some best practices about how that works. So there's a reboot of a task force that operated from 2022 to 2024. It's so in partnership with Boulder County Housing Authority, we have relaunched a task force. There's 18 people from across the state, which is really exciting. People from all different parts of agencies, housing, public health, private landlords are participating. So we're essentially just trying to gather a bunch of data, get best practices, be able to provide information to the state, as they are doing a regulatory review and have a multifaceted strategy to address the different issues that we see. In Boulder County, we're also having our own strategic planning session because every county has their own ordinance and relates differently to how they implement this. And so we want to be prepared for what could happen at the state level. And if it doesn't play out in a way that's favorable to our residents, what could we, approach here locally? And there will be a presentation on May 13th to the Longmont Landlord Association. Apparently last year there was a remediation company that presented to the landlords that had everybody really terrified that they were going to have to tear out all the carpet and all the HVAC system, and it was much more extreme. So this is trying to sort of provide the facts and help people understand what needs to happen.
Following the meeting last year, we were consulted and helped to provide a more fact-based presentation. And so they have invited us back again. They would like us to do the presentation.
And then I've got 2 local policy updates. So in Lafayette, the Communities That Care Coalition has been working with the Tobacco Education and Prevention Program, the TEP program. This is the community input onto what are the most pressing issues that they need to address, and youth identified vaping as the priority issue, just based on what they see in schools, what parents are seeing, not just use, but also the waste that they're seeing. And so the solution they've come up with is a tobacco retail license, which would essentially require businesses that are selling these products to pay a fee and to adhere to certain criteria, even things like there are vape pods that are not FDA approved or regulated that are being sold. It's things you would not want anyone, especially kids, to be consuming, along with like the distance between schools and businesses that sell them. And there's been a lot of outreach to the Lafayette Chamber of Commerce is on board with this. Parents are on board. There's been conversations with the sheriffs. And then in addition to that piece of it, there's the waste part. There's exponential growth in the amount of hazardous waste from the pods and the cartridges used in vaping. And so Boulder County Public Works is really interested in partnering on how to also have a fee so that those are disposed of properly. They are the cause of fires in landfills. And obviously they're not good to go into the earth or the waterways. So there's been some great outreach. There's a lot of headway being made by the team working on this, and the city council has had one discussion about it and is going to continue talking about how to drive this forward.
So the vape disposal work is work that our teams have been doing for a few years now, and was kind of recognized as nationally as an innovative initiative, and is being picked up by other public health departments across the country, but really innovated here.
And last, but definitely not least, is the sugar sweetened beverage policy work. So the Healthy Eating Active Living team and the Environmental Health Division continues to work on this. And there's a coalition of Lafayette and Louisville community-based organizations, schools, health professionals, youth, parents, and many more who are coming together to identify how do we improve the health of the community through reducing access to sugary drinks. They are engaging with the public, both by going to community events and inviting other people to these ongoing meetings. This is an event where Dr. Seth, it looks like I misspelled his name, I'm sorry. Dr. Seth Kramer was at a booth helping educate people. He's part of the coalition. Really exciting that a $25,000 grant from Johns Hopkins Bloomberg School of Public Health was awarded to Christina Edstrom and Amelia Holbert. And this is to commemorate the 10-year anniversary of the sugar sweetened beverage tax in Boulder, which Rachel Arndt led. And this is an opportunity to really highlight the impacts of that tax and through it have people understand how this played out in real life and sort of, I think there's still a lot of misinformation about what this means or what it can do. And it's, I think of, all of the taxes nationally that passed, it's been absolutely one of the most successful in its implementation and impact on the community.
Yeah, we actually, I'm going to toot Rachel's horn a little bit. We get requests from other places across the country regularly and across the state to teach them how we did it. Partly because the way that it was structured was so effective. So much of the money is really going back into the community in the form of grants. It's where a lot of our equity grants in the city of Boulder really come from. I don't know if you want to say more on that.
I was just gonna shout out to Summer Laws, who works in the commissioner's office and who worked at public health and played a really central role in the campaign as well. So I want to make sure to give Summer a lot of credit for that. And Tessa is also, as a community member in her volunteer time, on the Health Equity Advisory Committee for the city of Boulders. So the organization or the community coalition that reviews all of the applications. But I do think, yes, all of the analyses of the implementation of these taxes have really shown that, the design that we had in the ballot measure itself, and then also the advocacy that the community-based coalition did after the measure passed in terms of setting up the Health Equity Advisory Committee through the city of Boulder, and then the city's implementation requiring a competitive application process for organizations really evens the playing field for nonprofits and local governments and city-funded projects as well. And I do think that it is a model participated in a lot of like model policy toolkit making processes with Center for Science in the Public Interest and Healthy Food America. And we always lift up those elements of the tax as kind of the model practice. And it's not done that way everywhere. So it's, yeah, big hats off to the city of Boulder for sure.
Is there a reason Superior doesn't engage?
That's a really good question. I don't know if there's been outreach in Superior.
I can get back in touch with you. I have a meeting with Christina on Wednesday just to talk about, we just connect policy.
And one of our staffers has just been appointed I guess the manager of that fund.
Oh, yes. Sorry, I was spacing. Yes. We're excited to continue working with Allison Bailey from formerly with our community health division. She is going to be working with for the city of Boulder and overseeing the Health Equity Fund and also the Human Services Fund. So really excited for her new role.
Thank you. Okay. Yeah, moving on.
Yeah.
Item number 5, finance and budget update.
Just kicking off our budget season. Very organized this year. We have our fingers on lots of data. And we're kind of collecting all of our information so that we can start those conversations. Desiree and Sarah, thank you for bringing us to this point. And Desiree, you want to
kick us off?
give us an update?
Next slide, please. So here's your budget update for April of 2026. I'm Desiree Catarosian. I'm the finance manager for Boulder County Public Health, and I use the she, her pronouns. Next slide, please. So this is a comparison of the 2025 adopted budget with the preliminarily submitted trial balance numbers. The expenditures represent expenses from December 26, 2024 to December 25th, 2025. Just a little background, a trial balance are the initial figures we submit to our financial auditors to reflect our final general ledger balances. Now, these figures only shift at the auditor's request as we continue to work on the 2025 audit. So based on the preliminary trial balance, the agency's expenditures were within 3.6% of the adopted budget.
The comparison of budgeted operating expenses and actual expenditures does show a significant variance of 20%. The agency will continue to monitor operating expenses closely and evaluate underspending to determine the revenue sources and if reallocation to other areas or investments is a potential opportunity. Our initial assessment is these savings were a result of fiscally responsible spending during a time of budget conservation and will be instrumental in extending our runway to extend fund balance to the future. The 2025 budget was not amended by the Board of Health as we remained within our 5% tolerance for the year.
Hey, Desiree, before you move on from
You're good.
this one.
Yep.
I know we talked about this in our subcommittee meeting, but and I know you just said that we think this is from some just careful budget management, but it sounded like you all were going to try to dig in a little bit deeper and try to figure out what the origins of this 20% savings were from.
We are, yeah, and
Yeah.
we're happy to bring that information back to you, Morgan.
Great. I just wanted to make sure it's noted in the public meeting that we're like looking into it too.
Yeah, yeah.
I put it on the calendar, not for maybe next week, Morgan, but the following week, once we get through the budget amendment.
Super. Thank you.
I'm Sarah DeBoer, and I'm the senior budget analyst, and we're going to talk briefly about 2026. So this is a comparison of the 2025 adopted budget to the 2026 adopted budget. I think it's important to look backwards as we're starting to really get into implementation for 2026 and also to develop the 2027 budget. So as you all recall, we went through a very robust budgeting process using the tools and the around priority-based budgeting for 2026. So that's why that reduction of about $4 million that you'll see between 25 and 26. We also reduced our grant revenues to recognize funding for which we had notice of award letters or contracts on the grant side, which was a change in practice compared to 2025. As we move forward, if you want to go to the next slide, Patrick. What we are looking at right now is our year-to-date expenditures. So this is expenditures for January through March. The March numbers are preliminary as we're working through March close, and we'll have final March numbers towards the middle or late April. But as you can see, we are roughly on track. At the close of March, we would expect the programs to be about 25% spent, or 1/4 of their annual allocation. And you can see that most of the programs are pretty within those ranges. There's a few that are lower. Environmental health is one, but a lot of that at this point we believe is driven by seasonal changes. So the mosquito projects have not ramped up for the summer. We're also looking at strategic initiatives, has some later planned spending. So right now, really looking good for 2026. I'm gonna go to the next slide. So this slide shows you the projected revenues for the year. These numbers are changing. They actually, I'm working through the budget amendment memo today and tomorrow. So what you see in the first column, the adopted budget revenues, that is what was adopted in total funds for each one of the divisions. The projected revenue adjustment is 1.4 million. That number is high though. As we're going through this, remember that we are only recognizing grant monies for which we have a notice of award or a contract. So that number, once I start narrowing down which revenues we actually have, those award letters and contracts, is looking closer to about $500,000 to $600,000. So it is likely we will bring you another budget amendment in the September-October timeframe. The variance between what I'm seeing as having notice of award letters and contracts as of March 31st and the 1.4 million is really in your state contracts. And as Tessa said, we are in the middle of finalizing the state budget for July 1. So I think a lot of that money, we're going to start to see the notice of award letters and the contracts coming here in the next probably 6 to 8 weeks, which is where that 1.4, 1.5 number is being driven. And so that's why I'm just kind of prepping you that you will likely see another budget amendment later in the summer, early fall, to recognize that money that comes in on those state contracts. The third column is just the sum of your first two. So that would put us at a $22 million budget, or a 7% change from the adopted budget. But again, that includes everything that we're projecting, even things that we don't have notice of awards for contracts at this point, because we are being much more conservative. Any questions before I go to the next slide?
I'll go ahead.
Desiree's gonna take the
I'll
next
take-
slide.
I can take it from here. You don't have to go back to your seat. Okay, the preliminary fund balance draw was for 2025 was approximately $1.2 million. The anticipated draw was $2.1 million. Above on the left-hand slide, under the adopted 2026 budget, it shows the preliminary fund balance with no changes to the 2027 and 2028 total budget amounts. The revenue shown represents best case scenario for grant awards in 2026 of the $1.5 million in additional revenues that Sarah just explained. The figure on the right, the projected 2026 budget amendment, illustrates the projected 2027 budget of $20.9 million, which Sarah will discuss in a moment. Based on these figures, the 2027 reserve is projected to be $5.3 million with a draw of $600,000, resulting in a reserve of 19.2%, which remains in the 15 to 20% range mandated by this board. Any questions on that? Next.
So as Lexi noted, we are getting ready. We're actually kind of in the middle of 2027 budget development. The programs, if you remember last year, we worked through the tools using that priority-based budgeting framework. So the programs have already gone through and looked at their inventory. They are working through and provided me better descriptions of the program so that we know what's in them from year to year. We are working through the scoring of those programs and then the personnel allocations, all to start building towards the 2027 budget. If you want to go to the next slide, Patrick. Right now, we're looking at two budget scenarios. One is essentially flat funding. This is using the 2026 adopted budget of 20.6 million and making some known adjustments. So as Tessa and Lexi both alluded to, we did see a reduction in per capita funding from the state beginning July 1. That will hit us in the first 6 months of 2027. We also know that the CHAP grant is going down and there are some other known grants that will be going down, and that's what's driving that reduction of 400,000. The other second scenario that we're looking at is adjusted for grant revenue. So this starts to pull in some of those grants that I alluded to that we're waiting for contracts and notice of awards for that start July 1 that will have revenue impacts for the first 6 months of 2027. Too many fiscal years. The other thing that this one does take into account is we were told in November, December of 2025, we were asked for a $700,000 reduction by our friends over at the Office of Financial Management in order to address the shortfall in Boulder County. We have not heard, or at least I have not heard one way or another, if we're going to be expected to do that. OFM just came out with their budget instructions, I want to say last Tuesday, and I didn't see anything in there that said we were exempted from providing a cut. So out of being an abundance of caution, I've built in that $7 million reduction that's offset. Again, it goes up because of the increase in grant revenues that we're projecting in 27. So a lot of pushing and pulling of the numbers. And I think a lot more will become much clearer, I think, by the time we meet with you all and the commissioners in early June, because we should have, I think, a big big swing in our revenues as we're starting to look at 2027. So that's generally what we're looking at. Got cost of living adjustments and some other things that will also be pushing and pulling in there. So that's where we're headed for 2027.
We have our budget study session and BOCC retreat prep meeting on May 18th. So that is kind of our target for really being able to dig down a bit more with you all.
And I think those dates are on the last page of the memo that was in the packet from Desiree and I. And I'm happy to answer any questions you might have.
Lisa.
Go ahead, Elise.
Hi, sorry everyone. Can you hear me all right?
Yes.
Okay, awesome. Thank you. Thank you for presenting tonight, Sarah. And I had a quick question. I attended the Boulder County Supervisors meeting just this afternoon, just a little bit before this. And there was a brief update from Armando and our other friends at OFM about the 2027 budget guidance. One of the things that they mentioned there that I hadn't seen in previous communications was around that no new FTE requests will be considered during the fiscal year 2027 budget process. I didn't know how that will impact some of these numbers that we're seeing of our conservative versus maybe more generous estimates based on the revenue we're bringing in. And I don't know if that's brand new information or.
Thanks, Elise. Yeah, thanks for that question. So I'm answering this because it's not actually a budget question, it's a governance question. BCPH, we oversee our own staffing decisions and our own budget. So that is a decision for the Board of Health and for me. So no new FTE applies to departments reporting to the Office of the County Administrator.
Gotcha. Thank you. Like I said, it was just new information at that meeting and I was
Sure.
interested to hear it.
I will just say that, those two scenarios are not terribly far apart, and it's a real relief to be going into the budget season this year without looking at 25% scenarios. I feel like that we're really in a good position to be able to kind of roll with whatever comes our way this year.
Yeah, I will echo that. Just given how much work the staff did last year to go through the priority-based budgeting, it feels like it is paying off in our goals towards having a more sustainable and stable budget. So really appreciate all of the staff and the leadership team and implementing that big undertaking. And thanks to the budget and finance team for continuing to move us in a positive direction.
All right, moving on to item number 6, which is the director one.
I don't have anything to add today.
Any questions on the director's
I
report?
mean, I appreciate the call out for Sundance. Honestly, it wasn't really on my radar, like the impact it can have on the department in the city. So
Yeah.
appreciate like the heads up on that and the fact that you guys are already forward thinking about it. And also the great shout outs that were in here about like our staff presenting nationally at forums on our work. And I love to see you elevating all of the good work that's happening.
Those shout outs are something that we do internally with our monthly newsletter, but I like putting them in the director's report.
Agreed. Any other comments on the director's report?
Is it jazz hands or waving by? Not sure which that was.
That was Jazz Hands saying, yes, I agree. I love the shout outs. Thank you.
Okay, moving on then to item number 7, which is old and new business.
I do not have any.
Online. On to item number 8. Or item number 11.
Oh, yeah. Oh, I didn't read number 8.
You missed a couple.
It's number 8. This month's number 8.
So there being no further business, this meeting is adjourned at 6:54 p.m. Thank you.
Thank you.
Thanks, everyone.
Thank
Thanks, everyone.
Thank you for presiding, Amber.
She did a great job. I think she.
Exceptional.
I have